Hey there, I hope you had a great Thanksgiving and that you're getting ready for the holidays coming up. I'm Dr. Kevin Lewis, your Greenville injury and wellness expert. And this week, like we do most weeks, to answer a question that came up in the office. So this week, a patient came to me and said, hey doc, why do I have to keep going to the chiropractor? Why do I have to keep coming to you? So I thought I'd take this moment to answer that question because it's a very valid question. It's a good question. Why, when I get an injury or I have a pain or a problem, do I have to go back to the chiropractor more than one time? And again, that's a very valid question. Whenever we get a physical injury of some sort, whether it's a sprain, a tear, or in our case here in the office, a subluxation, it may take more than one time to correct that. And what I mean by that is, of course, as you guys see me, if you watched my videos in the past, you've seen me discuss this. What I'm talking about with a subluxation is the bones in your spine or your extremities. If the bones slip out of their normal position, now instead of protecting the nerves, they damage it. So here's an example of two bones from the spine, so two vertebrae, which are separated by the disc. Now think of the disc as a spacer that holds the bones apart so the nerve can pass through. And those nerves, just like the spinal cord, are there to send signals from the brain to control all the muscles, tissues, and organs. And normally when we move side to side or backwards and forwards. These bones will move side to side and rotate, and we bend forward, they bend forward and backwards. And so these bones are held together by ligaments, and the disc there is actually a type of a ligament. And so that works well normally, but if some force enters into the spine or the extremities and shifts one or more of these bones out of their normal position, now instead of protecting the nerves, it actually damages those nerves, it injures those nerves. And now it can cause pain and discomfort, muscle spasms, numbness and tingling shooting down in the hands or feet, or pain shooting down the legs or into the arms, and those kind of things. And what happens is inside those joints are the soft tissues, like I talked about, the muscles, tendons, and ligaments. So this is what soft tissue looks like under a microscope. So under a microscope, when we look at muscles, tendons, or ligaments, it looks like this, and there's all these crisscrossing fibers. Those fibers are usually made up of collagen. So think of collagen like rubber bands, and you've heard of that term before. And when you bend to the side, they'll stretch. And when you bend to the other side will stretch. When you stand back upright again, they'll contract. And that works well. That stretching back and forth allows the bone to move the way it's supposed to move. But if we get an injury, like you see up here, a tear can occur in that muscle, tendon, or ligament. Now, if it tears all the way through, you end up in the hospital having surgery and that kind of thing. But if it's only a partial tear, you may not even know it. Matter of fact, you may just start feeling better after a few days. Like you think, maybe I'll just get better. And after 3 or 4 days or a week or two, the pain slowly subsides. And the reason that pain subsides is the body goes in there to fill in that hole. It's obviously not going to leave a hole there. It's going to try to stabilize that. It's going to fill it in with something. It has to. Just like when you cut yourself and you see a scab form, that scab is filled in with what we call granular tissue. Granular type tissue moves into that area too. And just like a scab, when the scab heals and falls off, a scar is left behind on the skin. When this heals, a scar is left behind. And so we have scar tissue in that area. Now maybe we got another type of injury, and instead of tearing it, we push the fibers around a little bit. In that scenario, the body's still going to lay in scar tissue, not as much as you tear it, but then you end up with something that looks like this. And this stuff obviously doesn't function like that. This stuff is more fibrotic, so it's not as elastic, so the bones don't move the way they're supposed to. That's when you start to feel stiffer, tighter. You wake up in the morning, you can't move like you used to, that kind of thing. And that material is weaker, so it's more prone to injury. So that, after you've injured your back or your neck or your arm, and you felt like it healed, you're more prone to getting injured again if it's not corrected appropriately. I hope that makes sense. So our goal with the patient is to get it from here to as close to this as you can again. Now, you'll never have that again, but there's degrees of good. If with a patient we do a little bit of work, we get here, a little bit more work, we get here, and in many cases we can get it all the way right up close to normal again. And that's a healing process. Now, that process can take up to 2 years. And that really has nothing to do with the patient. It has to do with their goals and what we found on their x-rays. And then that time frame is straight out of Guyton's Physiology, the basic medical text, which says it can take anywhere from up to 12 to 24 months for the soft tissues to finish the rehabilitation process. So it's not a process that occurs overnight. And if you can keep those bones lined up the way they're supposed to and closer together, approximate those joints together, the soft tissues that hold them in place will heal better and heal stronger. So that's why we recommend going back to the chiropractor versus just 1 or 2 adjustments and saying, oh, it's going to be fixed. And I see it all the time when I take x-rays of a patient who's been under chiropractic care for years before, but they've only getting sporadic care, not following recommendations and getting 1 or 2 adjustments here or there. We look at the x-rays, especially a motion study x-ray, and the bones are not moving the way they're supposed to. A lot of arthritis and decay have set in, and everything's starting to break down. So we recommend frequent, regular care to keep it getting healthier, keep it getting stronger, and keeping the patient happy, healthy, and living the life that they want to live. So I hope that answers that question for you. I hope you guys have a great rest of your week, and we look forward to seeing you here next week. Now, do be looking for some of the posts that we have coming out. We've got some specials coming up in December, and we've got a prize drawing coming up in December. I hope you guys have a great week. We'll see you here next week.